Hey guys, thanks for joining me again for another episode of my YouTube channel, Long Live the Brains. Today I'm going to discuss a hot topic, and that's traumatic brain injury, or TBI for short. This topic has gotten a lot of press associated with various sports like football and soccer and boxing, as well as with our soldiers as they're returning from the battlefield. But today, and in keeping with the focus of Long Live the Brains, we're going to talk about the risk of developing dementia after sustaining a TBI. Now, there have been a lot of studies that have attempted to answer this question, and it's a hard question to answer. A lot of that is because many of these studies have been done in a retrospective manner, and that's basically kind of looking back and trying to dig through the records to figure out, if someone has had a TBI and if they develop dementia. Sometimes we're relying on an individual's memory of whether or not they had a TBI, a concussion, and that can not always be 100%. So there was a study that was published in the Lancet Psychiatry in May of 2018 that was conducted in a prospective manner, and the authors were from Denmark. This entire study was done in Denmark, and they looked at 2,794,852 people, and they looked to see who sustained a traumatic brain injury, how severe it was, and if someone had more than one, how many they sustained. And of all these, more than 2 million people, they also looked at who developed dementia. And what the authors were able to find is that among those people who had a TBI, even if it was a mild TBI, there was an increased risk of developing dementia. Furthermore, those people that had multiple TBIs had an increased risk of developing dementia, and those with severe TBIs were at an even greater risk of developing dementia. So altogether, I think the major punchline is that if you have sustained a TBI, there is an increased risk of dementia. Now, an important point to make, though, is that we're talking about risk. Okay, this is not guaranteed. So, the fact that you sit down in a chair, there's a risk that chair is going to break. However, it's not as great a risk as if 3 people sat down in the same chair. If 3 people sit down in the same chair, it's not a guarantee that the chair is going to break. It's just an increased risk. So think of it in that manner, that even though this trial suggests that a TBI is associated with an increased risk of developing dementia, a TBI does not guarantee that you will develop dementia. Okay, and don't forget to drop some comments, drop some questions, subscribe to the YouTube channel, hit the notifications button so that you're notified every time I post a new video.